Hello, my name is Paul Sacco. I'm an assistant professor at the School of Social Work at the University of Maryland, Baltimore. I'm here today to talk to you a little bit about my research funded through the John A. Hartford Foundation. First, I'd like to thank the Hartford Faculty Scholars Program for providing me with the funding necessary to conduct this research. Now, to provide some context for my research through Hartford, I'd like to tell you about my overall research interests. I'm interested in the use of alcohol among older adults and other substance use as well, such as drugs, medications, as well as gambling. What we know about alcohol use among older adults is that it seems to be a two-edged sword. Some alcohol use among older adults can be associated with healthy aging, in that older adults can drink on a daily basis, and there seems to even be some potential health benefits associated with that. Conversely, excessive alcohol use among older adults can be associated with negative outcomes such as falls, illness, strokes, and increased mortality in this population. For the project that I'm doing with the Hartford Faculty Scholars Program, I became interested in the relationship of older adult drinking to their motivations for drinking, both social and other motivations as well. It seems like the literature on older adult drinking focuses on kind of one of two potential aspects. On the positive side, older adult drinking is associated with socialization, with continuity of earlier life habits, and with general positive health. On the other side, older adult drinking is also potentially a problem in that older adults may drink as a means of dealing with painful feelings such as loneliness and stress, and then also health conditions such as problems with pain or sleep-related problems. The study that I'm doing for the Hartford Foundation seeks to kind of unpack some of those relationships through a methodology called ecological momentary assessment. Now, for this study, we're doing a modified approach to that. What we're doing is we're going out to a local continuing care retirement community, and we're conducting interviews to get some health and other background information on older adults related to their drinking. Now, these current drinkers are then followed for 8 days. What we do is we provide them, or we call them once a day, and we ask them questions about their alcohol consumption the day before, as well as different social and emotional aspects of that day as well, such as what kinds of activities did they take part in, what kinds of emotions or feelings did they have problems with sleep, what was their stress level like. We do that for 8 days, and then we ask a series of follow-up questions in terms of history of alcohol-related problems, services use, and things like a family history of alcohol-related problems. The overall goal of the study is to understand the relationship of drinking motives, such as social enhancement or tension reduction. And by tension reduction, I mean things like drinking to help yourself to sleep at night, and the overall well-being of older adults, how much they consume, and the frequency of their consumption. Right now, we're about halfway through with our data collection. To some extent, this is a pretty intense approach to collecting data, and we're about halfway there. We look forward to, in about the next 3 months, to having our data collected and beginning our analysis, and within the next year, presenting some of our initial findings at national conferences. So thanks for providing me with the opportunity to talk about my research today, and I look forward to hearing the other research interests of our faculty scholars in cohorts 12 and 13.